Hey, Mark Rosenberg here, and we're going to work on some exercises that I used to teach my martial arts classes for breathing. A little bit of anatomy, then we'll get right into business. The diaphragm sits here. It's a powerful muscle. The lungs sit on top of the diaphragms. The bottom part of the lungs, these lobes, are larger than these lobes. So when people have distressed breathing because they're emotional or because they're really fatigued, they breathe from here. So what I've trained my students to do, and something I learned from my teacher at a young age, was to breathe from the belly. Are there lungs in the belly? No, there's not lungs in the belly. But by relaxing your belly out, you're below the diaphragm, the lungs drop down, and then air can flow into the lower part of the lungs. So as a result, it has a calming effect on the emotions. That's one thing. But as a result, you can get a greater volume of oxygen in your body. So let's talk about karate. So people will be fighting and they're tired and they're fatigued. Maybe they got hit a few times. They go, okay. First of all, you're showing your opponent that you're weak. You're showing your opponent you're fatigued. Okay, and you're going to get out of breath, and then we know what happens then. So if from this position here, and I'm not teaching martial arts, I'm just giving you a concept right now. I've been doing martial arts 45 years, so I've got a little background in it. When you're breathing, if you breathe, notice how my upper body isn't moving, just my lower body is, so even if I take a deeper breath. So first of all, a couple of things. My opponent doesn't know what I'm experiencing. I just look like a steady, stable opponent. Who's our opponent now? This virus. So we have to do everything in our power to make sure that we can defeat it. So if breathing more efficiently is going to help you, you got to do it. So again, this is not a cure. This is not going to take away the virus. But if you're having some anxiety about this, and a lot of people are, or if you're having some shortness of breath, you just have a normal cold or flu in your home, and the doctors told you don't come into the emergency room. Yeah, you just stay home. Okay, these are exercises that you can do. So to follow up, you put one hand on your belly or right below your solar plexus and put the other hand on your chest. So for an experiment, just take a deep breath into your chest. See how that feels? It doesn't feel powerful. So what we're going to do is we're going to hold our hand here and try and breathe into the belly. So I breathe in the nose. I breathe out the nose. And notice my upper body is not moving, just below. So as I breathe out, at first you're going to have a little bit of a awkward time with practicing to use these muscles to pull out to allow the diaphragm to drop down. And then exhale. And inhale. Then exhale. And a little slower, inhale. Exhale. Inhale. Exhale. So this can become very meditative for you if you do it for a few moments every morning, a couple of times during the day. It'll pull the tension away from your upper body. And people who are stressed, they hold tension up here. That's why people have high blood pressure, and headaches and everything going up. We want to go down. Again, my background's in the martial arts, many years of karate, tai chi. So this is a technique that we would use, to calm ourselves, to be more powerful in battle, and to not get fatigued very fast. So there's multiple benefits. Okay, that's our video for today, and you could do it after you did the previous one with the points on the shoulders and everything, and we're going to start to open this area up. Okay, stay safe, my friends.